Hello all of my wonderful TM joiners. I'm Priya Mistry, the TMJ doc, and today I'm going to talk to you guys about an anterior open bite. So what is an anterior open bite? What are the most common causes for anterior open bites? And what does an anterior open bite have to do with TMJ disorders? Watch this video until the end for the answers to those questions and more. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Be sure to hit that subscribe button and the little bell next to it if you want to receive notifications for when my next videos will be out. I post a new informational video every Friday for people who are suffering from TMJ disorders or just for people who are looking for more information in general. If you don't know who I am, I'm a general dentist with a practice in Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So let's get right into it. Let's start by defining an anterior open bite. Anterior means forward or near the front. So in this case, it's referring to the front teeth. Open bite means that the upper and lower teeth are not touching. So anterior open bite means the front teeth are not touching while the back teeth are touching or meeting each other. In an ideal bite, all the teeth, front and back, should touch each other to distribute the forces of speaking and chewing evenly. What causes an anterior open bite? Well, there are two main causes. So let's start by talking about the first one. The first main cause is a tongue thrust. What is a tongue thrust? A tongue thrust is when you push your tongue forward between your top front teeth and your bottom front teeth when you go to swallow. So if you have a tongue thrust or if you swallow that way, you may be thinking, well, doesn't everyone swallow that way? And the answer is no. There is a correct way to swallow, a correct swallow pattern. The correct way to swallow is with the tongue up against the roof of your mouth, and as the food is pushed further back towards the esophagus, the tongue moves up against the roof of the mouth in a wave-like motion, with the tongue making contact with only the roof of the mouth throughout the entire swallow. So go ahead and gather up your saliva, dear watchers, and before you swallow, tell yourself to really observe and be aware of what your tongue is doing when you swallow. Does it thrust forward? Does it go up against the roof of the mouth? So now go ahead and swallow, and I'll do the same thing. When I swallow, the tip of my tongue touches the soft tissue behind my front two teeth. And as the saliva moves further back into my mouth, as I continue to swallow, the rest of my tongue, the middle of my tongue and the back of the tongue, then also make contact one after another with the roof of the mouth. The point here is that my tongue never comes forward. Does yours? If so, you may have a tongue thrust, which is not ideal, because thrusting the tongue forward 1,000 times a day when we swallow, and yes, we swallow at least 1,000 times a day, can actually create an anterior open bite over time. How does that happen, you ask? Because that forward thrusting motion of the tongue is actually quite powerful, and muscle will always win over bone. The tongue is an organ supported by a lot of really strong muscles, and teeth are essentially bone. They're actually stronger than bone. Bones or teeth can actually bend or change shape or change orientation over time with the powerful forces that muscles can exert. Therefore, the forward thrusting of the tongue can actually lead to a separation of the top and bottom teeth. I've seen it time and again with my patients. So how do you correct this? Well, if you already have an anterior open bite due to a tongue thrusting habit, the first step is to actually correct that tongue thrusting habit. And the way to do that is find a provider who's skilled and trained in providing myofunctional therapy. Do not attempt to correct that tongue thrusting habit on your own. You can strain muscles and that can lead to pain. For more information on myofunctional therapy, please watch my videos, What is Myofunctional Therapy? And Tongue Posture Do's and Don'ts. I've linked both of them above. Now let's get into the second most common cause for anterior open bite, or just bite changes in general, and that is degeneration within the jaw joints. This is much less common than tongue thrust, and it is much more difficult to treat. Our jawbone is part of the jaw joint, obviously, and it also houses all of these lower teeth. If that jaw joint starts to degenerate, it's going to affect the bite. It's going to change the orientation of the jaw in three-dimensional space, which will then change where the teeth are in three-dimensional space. So if the lower teeth are literally sitting in a different position, they will be hitting the upper teeth in a different way. So that will be perceived as a change in the bite. Again, this is not as common as a tongue thrusting habit being the cause of an anterior open bite, but it can certainly happen. So what do you do about it? Well, the first step is to see a good TMJ dentist in your area. That leads us to the question, what does an anterior open bite have to do with TMJD? So why am I talking about this? So as I've mentioned in my previous videos, the two jaw joints and the way that the teeth fit together like cogs on a gear, that is like a tripod-like relationship. And what happens when you cut off one leg of a tripod? Well, the whole system goes out of balance. Well, apply that analogy here. What happens if the bite changes? It can definitely impact the jaw joints. It can negatively impact the jaw joints. It can cause clicking, popping, or episodes of the jaw locking. Additionally, the muscles of the head, neck, and jaw are also affected when the bite changes. The muscles of mastication, the chewing muscles, as well as the muscles of just this whole complex can become dysfunctional if the bite changes drastically, and that typically manifests as pain, headaches, jaw pain, neck pain, ear pain, and more. So if you're experiencing any of this, see a TMJ dentist or a TMJ physical therapist in your local area. So that's really it, my friends. I hope you learned something new and like what you heard, and if so, click like below, subscribe to my channel, do all the things. As always, questions and comments are welcome. And remember, my friends, you can never have TMI about TMJ. Thank you.